Hello everyone, my name is Dr. Katramdan. I work with Frontline Hospital, and on this day, 29th of October, every year we celebrate the stroke patients. It's the World Stroke Day. Well, it's a day where we get acquainted, is where we get to know more about what stroke is all about. What is stroke? Okay. Stroke mainly means it's a sudden injury to the brain. Okay, it's usually sudden and it's usually an injury to the brain. Most times it's part of the brain and usually due to an interruption in blood supply. What we need to know is every time any part of your body does not receive blood, it cannot survive. Most parts, if it goes beyond 10 minutes, they will start to die. And that is not an exception to the brain. So every time you have an interruption to the brain or a supply of blood to the brain, it will start to die. When that part dies, it will lead to what we call a stroke. A part that is dead or a part that is affected by the lack of supply of the blood will be noticed by what your body will portray. Now, stroke can affect any part of the body depending on which part of the brain has been affected. We have to note that every single year, over 15 million people are affected by stroke. 5 of those recover, 5 of those unfortunately don't make it, and 5 millions of those end up with long-term disabilities. So it's not a disease, it's not a condition we can take lightly. What causes stroke? We have talked about. How are we able to note that this person may be having a stroke or may be pending a stroke? There are features we can tell on our bodies, okay, that will alert you that maybe I am getting a stroke, or maybe my grandfather, my mother, my sister is actually getting a stroke. On the face, you will notice by one, you may have issues with your eyesight. Probably you're not seeing well from nowhere, okay? Then you might actually fail to speak. You might have dripping features. You find your mouth is deviating. Your face is basically deviated to one side. It could be the hands. You find that you have weakness in one hand, or actually one hand could be completely paralyzed. If it's not paralyzed, you may actually have both of them. Same thing with the legs. So regardless of what type or what is causing the stroke, you will notice these features. There are mainly 2 types of stroke. And like I mentioned, we have interruption of blood. You can have interruption, one, because of an obstruction, usually due to a clot. And when that happens, that's what we term as an ischemic stroke. It contributes to the highest percentage of our patients, and about 85% of people get stroke is an ischemic stroke due to obstruction. However, the 15% of these people will have an hemorrhagic or a hemorrhagic stroke, where you actually have a burst of these arteries that supply the brain. So if you have an artery that supplies a particular part of the brain rupturing, that means the part of the brain that is supplied by that artery will not receive blood, and hence the person will have a stroke. Those are the 2 major types. Regardless of which type you're getting, the diagnosis of stroke is the same. We usually use imaging to have definitive diagnosis for a stroke. Imaging, we usually do a CT scan, we usually do an MRI. They are the major ones we use in this country, and they can conclusively give us the exact type of stroke so that we know how to manage the stroke. How do we manage the stroke? Most of the time that we manage the stroke is dependent on what is causing the stroke. For example, as I mentioned earlier on, if it is due to a clot, our target would be to either remove that clot or shrink that clot, or basically break down the clot, what we call thrombolysis. Whatever we do is to get rid of the clot. If the cause is the rupture of the vessels, most of the time people who experience, or the victims that experience the hemorrhagic strokes, is usually people who have hypertension. The blood pressures are too high and cause rupturing of some of these vessels. When that is the case, our aim would be to lower the blood pressure of this person. So usually it depends on these two. We have to be able to diagnose this person, know what exactly the type of stroke is, and then we can manage the person. So once we have managed the person, most of the time strokes don't resolve in a day or 2 days. Most of the time people, victims of strokes, take months to recover. A few might be fortunate and take weeks. And some strokes are temporary. They resolve actually within 24 hours, and those are the ones we call TIA, okay? Basically, these are temporary kind of strokes. And most times when you get these, you just know that probably I'm impending a major stroke. So TIAs usually take, or transient ischemic attacks usually take less than 24 hours. You get a short-term temporary deformity somewhere or an impairment somewhere, and it resolves. When that happens, just an alert, and you should be very careful. However, most of our patients will take months, okay, to resolve or to recover. And because of that, you'll find that our patients of stroke usually are managed by multiple disciplines in the hospital. It's it's a team of doctors that come together. Among those, it includes the physiotherapists, those that do nutrition, those that do counseling, the physicians, all come together to manage these people. It takes time, and most of the time, we may or we may not have complete recovery of these patients. Today, you knowing the symptoms, you knowing how it's important for us to have this diagnosed, please take care. If you're hypertensive, have your pressures checked regularly. We do not want you to reach that extent, yet we could have prevented it earlier. I remain Dr. Katuram Dan on behalf of Frontline Hospital. God bless you.